Well, good morning, everyone, and welcome to Aging Untold Extra. I'm Ethan Watts, filling in this week for Christina.
Welcome, Ethan. I'm Sasha Bray. We are happy that you are here. Every week we are joining you for a program looking back on the topics that were discussed on Aging Untold throughout this entire week. So we listen to you, we connect you with more information and local resources that might be able to help you or your family going through things related to aging. Maybe you're someone caring for someone who is aging.
Yeah, and this week we are talking about how your sleep habits change as you age, and talking with an Alzheimer's expert about the symptoms of psychosis and the steps that you can take to help.
Some really interesting things on tap for this week. Aging Untold Extra starts now.
Aging Untold Extra, sponsored by Area Office on Aging of Northwest Ohio.
Well, we all have heard how important sleep is, but how many of us are actually getting enough rest?
I'm going to ask you about that in a little bit here. This is a concern and a priority for people of all ages for sure, but there are some changes that can occur as we age, which impact our ability to have healthy sleep hygiene. But the good news is there's hope, and I talked with a ProMedica resident family physician for a better understanding. Take a listen.
As we age, specifically as we get older, like ages 65 plus, what we start to notice is that it sometimes takes a while for us to fall asleep. We also have frequent awakenings at night, sometimes, and looking at the sleep stage level, we spend, it takes a shorter period of time to get to the REM sleep, which is the rapid eye movement stage of sleep, which means less time in the deep restorative sleep phase. People tend to wake up earlier in the morning too. So we see a shift of the circadian rhythm, if you will, where people will, as we age, go to bed earlier, but wake up earlier. And because we're waking up so frequently in the middle of the night, feeling more tired throughout the day, and feeling like we have to take more frequent naps during the day than we used to.
Is this alteration just a part of the aging process? Is it just the changes happening in our body, men and women?
Yes, you see in both genders. And sometimes it can be related to underlying conditions too that are more prominent as we age too. So it's important to kind of delineate which are we struggling with sleep because of the normal patterns that change as we get older for sleep, or is there something underlying that's causing us not to sleep as well anymore?
When you have those changes, the more frequent wake ups and that sort of thing, what can that do to a person to sort of exacerbate their physical symptoms? I know not getting sleep is not a good thing.
Yeah, and I think for anybody, decreased sleep, you are feeling tired throughout the day. You feel more groggy, some brain fog, trouble concentrating, and other things too. It can kind of affect metabolism if we're not getting the proper amount of sleep. We have trouble really metabolizing fats and sugars, like things that we're eating throughout the day. We might not feel as much energy to go work out and get some exercise. So there's kind of this cycle, if you will, that when we're not getting enough sleep, we might be sleeping more during the day, exercising less, and then when we're doing all of those things, then we're less likely to sleep at night too. So
That
it's
makes
this
sense.
vicious cycle that it takes work to break yourself out of.
So when you're taking naps during the day as well, in terms of just sleep, does that help or is that sort of a band-aid on the problem?
So yes and no. It kind of depends on when you're taking the naps and for how long. Um, Usually naps earlier in the day, like 20 to 30 minutes at a time are okay. But if you start taking it later in the afternoon or in the evening, that starts to interfere with your ability to fall asleep at night.
And you're just reinforcing that cycle.
Yes.
So you mentioned a moment ago that there may be some steps you can do to address this. So that would be a very hopeful thing if someone is going through this right now or on the cusp of going through it. What
Yes.
can we do?
Sure. And there's definitely hope. So not all hope is lost. Things that can be helpful are, and I would say this is advice for anybody who struggles with sleep too. Um, some things can be, one of the things we tend to do is like watch TV or be on our phones before bed. Like I know I'm guilty of like scrolling on social media before I go to bed. But that blue light can kind of trick our brains into thinking that, oh, it's daytime. So then our brain is like, it's daytime, it's not time to fall asleep. So try to minimizing those blue lights, the TV, the phones, computers, at least I would say an hour before bed. So when you're going to bed, make sure you're lying down in a dark room. If you need some white noise, like I need white noise when I sleep, like a fan in the background, or there are like white noise machines or apps even on the phone, which will play without lighting up the screen. That can be very helpful. Other things too is, as we had mentioned before, is if we do take naps, to avoid taking it in the afternoon or evening. Avoid taking using like caffeine, being mindful about caffeine use. If you need your cup of coffee in the morning, that's okay, but trying to minimize how much we are using caffeine, like coffee, pop, tea, etc., in the evenings, or maybe going more towards like a decaf option if we like the taste of it. Other things that can be really helpful are chamomile teas before bedtime, or for folks who like aromatherapy infusions or infusers, some lavender scented can be really relaxing and help with sleep too.
You're laying in bed, tossing, you're turning, and you're looking at the clock if you have one in there, and it's 5 minutes, 10 minutes, a half hour, an hour, you're still not asleep, starting to get a little stressed. I read that it's good to get up and get out of the bedroom. Is that true?
Yes. And I would say too, the time in the bedroom and the bed, that should be reserved for sleep. I would avoid doing any other activities, specifically in bed in the bedroom, other than sleeping, because that conditions your brain where I'm in bed, it's time to go to sleep. Whereas if we try to do other activities while sitting in bed or laying in bed, then the brain associates being in bed with a bunch of other things and not just sleep. So we're trying to trick our brain a little bit to get those healthy sleep habits. But just as you said, if you're laying in bed and it's been 30 minutes, if it's been an hour, time to get up, leave the room, as you rightfully said, and maybe do like an activity that to do for a little period of time, like again, like 20 to 30 minutes. It could be reading in another room, or I know some people like to crochet or do some other activities, and or take like a small walk around their house. Not anything so um nothing so exertional where it would like wake you up more, but sometimes some things like that. And when you when you start to feel tired again, that's when you go back and try again, and then you kind of rinse and repeat.
Last question I have, your thoughts on melatonin. I know it's an aid that a lot of people use, and they often think, okay, well, it's not like a sleeping pill, it's not medication. What do you say about that?
Yeah, melatonin I think is a pretty good tool to try to help us fall asleep. So our body naturally makes melatonin, our brains make melatonin, and that helps regulate our circadian rhythms. Um, so melatonin, like using over the counter as a vitamin, it's kind of supplying or supplementing what your body already makes. And with melatonin, it can be helpful to take, I would say, about 30 to 60 minutes before bed, um, and to try to help shift your body, shift your circadian rhythm, to try to help you fall asleep a little bit better when you are trying to fall asleep. In terms of, there are several different formulations over the counter too, so you kind of have to be a little bit cautious in terms of brands or which, like, what exactly is in it. So reading the label is super important. Um, Dose wise, I know people sometimes they will advertise like very large doses, like 10, I've seen like 30 milligrams. Um, but realistically, you don't need anything more than 5 milligrams, because over that you can have some grogginess during the day or headaches. So you kind of hit your like max effective dosage at 5 or less would be better.
Sleep apnea. Is
Oh
that
yeah.
it becomes more common among older people?
Yeah, and a lot of the times it can be tied with things like obesity too. And as we get older, we kind of put on a little bit more body fat. And that can cause extra tissue to be up around the neck and the airways. So then when you're asleep, those airways close, and you stop breathing at night. And that can be really disruptive towards sleep. So untreated sleep apnea is a huge, huge issue. And in terms of, it's really important if you suspect you have sleep apnea, like your partner complains of loud snoring at night, or they witness you stop breathing in your sleep. Or sometimes it can be an indication to us that you have sleep apnea if you have conditions like obesity or hypertension, that can kind of clue us in. Maybe we need to get a sleep study to see if we would need like a CPAP or the positive airway pressure to try to keep those airways open as we're sleeping.
I just researched this weekend, and I was looking at home sleep apnea tests. Do you
Yeah.
think they're a good option or not really worth it?
Yeah. So we've kind of been shifting, I think, more towards like the home sleep study tests. Sometimes usually the lab is going to be like, in the sleep lab is going to be the most accurate, but I think as sleep study tests have progressed over time, that they still have given us a decent amount of diagnostic purpose with it. Now, the caveat being is sometimes if we do the sleep study test, if we need more information, we might have to do the in-lab sleep study anyway. But I think it's a good starting off point, especially with individuals who might not be able to leave their home overnight, or like if they're taking care of other family members or things like that. And I've noticed some insurance companies too have kind of preferred to order the home sleep studies as opposed to the in-lab ones. And usually that is related to cost. That the home sleep studies tend to be more inexpensive compared to the in-lab ones.
Okay, so we mentioned at the top of this that sleep is important for all ages. The doctor, of course, seconds that. I know from working an odd shift, that's a hard thing.
Yes, definitely. I think the dark curtains, any kind of routine to wind down, unplugging, kind of investing time in breaking things down, relaxing a little bit, definitely helps you immediately. And then obviously, as we just saw, helps you in the long run.
Yeah. Have you ever noticed that you can fall asleep fast, but then you wake up like a couple times during the night?
I do.
That's what
I
we think.
stink at falling asleep, so I'm not the sleep person to talk to. It's no good. It's no good.
Well, thankfully, we have advice from experts to help us work our way through that problem. Stay right there. We'll be right back.
Your next chapter can be your most rewarding. Leading Later in Life is a program designed to help seniors grow, connect, and give back right here in Lucas County. You'll meet local leaders, build new friendships, explore meaningful volunteer opportunities, and enjoy exclusive tours of businesses and organizations, plus a guided look at the history that makes our community special. For more information, call or email the Area Office on Aging today. Scan the QR code to enroll now.
Well, welcome back to Aging Untold Extra. We've talked a lot about Alzheimer's. There are more than 7 million people across the U.S. living with the disease, and that number is expected to double by the year 2060. Right now, there's no cure, but there's a lot of research that is happening to help. We have Dr. Greg Grossberg with us from the St. Louis University School of Medicine. So, Doctor, you've been focusing a lot of your research here on behavioral changes linked to dementia. What are some of those changes that patients and families can expect?
Yeah, so there are a number of what we call behavioral or neuropsychiatric symptoms that accompany Alzheimer's disease. Things like irritability or agitation, kind of mood disturbances. But the one that we're going to focus on today, which is very common, affects about half of individuals, is what's called psychosis in Alzheimer's disease, where individuals can hallucinate. They can see or hear things that can be very distressing that you and I don't, see or hear, or they can have firm beliefs like paranoid kind of symptoms, accusatory behaviors called delusions that can also impact their quality of life as well as their care partners.
So how should families deal with that? First off, you mentioned the fact that it might be hard to even understand what's happening as you're looking at your loved one go through this.
Yeah, I mean, the first thing for families to keep in mind is that their loved one with Alzheimer's disease who has these behavioral symptoms is not going crazy, that this is a very common accompaniment. It's a very common part of the disease itself. And then to make sure when you go see your doctor or your primary healthcare provider, to let them know about these neuropsychiatric or behavioral symptoms if maybe your loved one is hallucinating, seeing or hearing things, or have these firm beliefs that are not true, that are making them kind of very irritable. And it's important for families to know that there is hope, that there are medications in the pipeline through clinical trials, specifically focusing on the psychosis in Alzheimer's disease.
Sure. You mentioned all of that research that's happening. We know it's going on across the country. So let's hone in on some of your research and those clinical trials. What types of studies are being offered right now?
Yeah, so the studies that we want to focus on would be new medications in the pipeline, new treatment for psychosis and Alzheimer's disease. And this new medication and medications are being studied throughout the United States at multiple clinical trial sites, including near Toledo and all over Ohio and other states as well, where we are moving closer to FDA approval for a drug. But of course, as you know, before a drug can get approved, it needs to go through the trials, the clinical trial process. And that's what's happening right now.
So for those families out there who might be dealing with this for years, or perhaps they're just dipping their toe into this and they might be desperate for one of those trials, how do you find out if you're even eligible to try one of these medications?
Yeah, so first of all, there's a really helpful site that you can get on, a website called navigatingalz.com. It's all one word, navigatingalz.com, for more information about psychosis and Alzheimer's disease, and also to locate a clinical trial site near you. After which the families contact the site and they would begin the screening and go from there.
And of course, all clinical trials are different, but any cliff notes here for a family that might be considering a clinical trial and going down that route? What should they expect?
Well, one cliff note, I like that idea. One cliff note is that you need to have a family, you need to have a care partner. You can't just go by yourself. You need to have transportation. You need to be putting some time in because you're going to be going to the clinical trial site regularly. They're going to be calling you regularly to check on how the patient's doing, how you're doing, how the medication's doing. Are there any side effects? Are you seeing any benefits? So you have to be devoted and dedicated to that. But the payoff can be very high because these medicines are really looking promising at improving quality of life by treating the symptom of psychosis in Alzheimer's disease.
And for people who don't know, I guess I should have asked you this earlier, but when we talk about psychosis, I mean, this is essentially like an out-of-body experience, right? It's different for everybody.
It is different for everybody, but the psychotic symptoms fall into the two groups. One would be hallucinations, seeing or hearing things that aren't there that can be very distressing. And the second are delusions, the firm conviction that a patient has. Maybe I had a patient recently who was in a long-term care setting who felt that their food was being poisoned. they refuse to eat. That's a psychotic symptom called a delusion. And we are making progress in treating these with hopefully a new FDA-approved medication that's on the way.
Well, it sounds like things are headed in the right direction. Doctor, thank you for giving us a few minutes of your time. And one more time for our viewers out there, the website where people need to go if they would like to learn more about clinical trials.
Yeah, so people should go to Navigating ALZ, all one word, navigatingalz.com.
Well, perfect. Thank you so much for a few minutes of your time and your expertise. We really appreciate it.
Thank you.
Spring can be messy, change quickly, and being first is everything.
13 First Alert Weather. Always ready, always streaming. On air, online. When big stories break, you'll find them on 13 Action News.
Welcome back to Aging Untold Extra. As we get older, there are a lot of conversations out there that might be happening about end-of-life care. You might be going through this with one of your own parents or even your spouse. We have Kelly Cheney with us. She's a registered nurse, hospice community educator with Hospice of Northwest Ohio. So what is the most common myth that you typically hear about hospice?
Sure. So the most common myth that we hear is that hospice is a place where you go to die, and that is not true. Hospice is a service. It's not a facility, although we do have 3 inpatient facilities, at least with Hospice in Northwest Ohio. But typically 80% of the hospice care is performed in the patient's home or wherever the patient calls home. So home could be in a nursing home or a specialized center. So that is a misconception. That is a myth that people think that when you're ready to die, you just go to hospice, where hospice is a service that can come to wherever the patient calls home.
So for people who have no idea what hospice even does and offers, can you explain that a little bit?
Hospice offers many services: nursing, medication, social work, spiritual care, bereavement services. We also offer home care, aid assistance. We do a lot of planning that can help with maybe financial services and just things that help the family, help the patient to prepare for this really difficult time in their lives. And so those are many of the services that are offered.
So you mentioned the fact that hospice means that you're dying, next week or something like that. Does it mean that you're dying soon? What qualifies you for that? And there are times, right, where you can be on hospice and then go off hospice and then be on hospice again.
Absolutely. So to qualify for hospice, there is a certain criteria. You need to be deemed by your physician to have 6 months or less of a terminal disease that may say that you have 6 months or less to survive. You forego curative treatments. So say maybe, I have been diagnosed with a type of cancer or another type of, not just cancer, but any other terminal disease, and I have 6 months or less deemed by my physician. I want to not go on any aggressive treatments or anything that's going to be curative. I just want to enjoy the last final months, days of my life, knowing how I know how to do that at home with my family.
I went through this with one of my parents, and I'll tell you what, I had no idea at the time what I was working with here. But when those hospice care nurses came in, they really do a great job of just explaining everything, right? Because there's a lot of things that I think that we don't talk about when it comes to, here's what's going to happen when you are close to end of life. And staff is so knowledgeable about this.
Absolutely. We do a lot of education. We are also certified dementia practitioners, so we help a lot with the aging population. We have, like I said, we have patients in all areas and actually all ages too. So you don't have to be elderly, you don't have to be older. We see pediatric patients as well. And so we're very knowledgeable with the entire lifespan and how to care for that patient, especially at this difficult time. We can talk about what it's going to look like the next few months and with the trajectory of that disease or that the process of the body as it's starting to die. Our body knows how to die. It knows how to transition. And so what does that look like and how can we help with them and help with the family to take care of that patient? And how the patient can help themselves as well and know what to anticipate.
Well, I think that brings up another point, right? Patient care, of course, yes, that's your number one thing. But I actually think the more important thing that you're doing is that care for the family. Those people who are emotionally either exhausted or really scared about what's next, right?
Yes, yes. It's a difficult time. It's a time when we don't want everyone to live forever. We want to live forever. We want our family to live forever. And so it's a difficult time when we see that our efforts are um, failing, but we're not really failing. We are all gonna pass. We're all gonna transition onto wherever that next place may be. And so embracing it and being just knowledgeable on how to take care of that family member gives some peace and reassurance that we're doing the right thing. We're helping them because it's all about comfort and it's all about just making sure that our family member is at peace.
And I'm sure that you, working in this field, you've had lots of different stories here. Anything anecdotally that you could share here about someone's last wishes, right? Some people might want to take that last trip. They might want to go get their last ice cream, whatever it may be. And you guys try to make things like that possible, right?
We do. One of our values is making moments. And so we try our best to make moments. If there was a time where there was a gal who wanted to go to a cat cafe. And so we want to make sure that what we're doing is safe, honoring those wishes. And so we do the best we can. So we were able to bring in some cats and offer her tea and coffee and, different little treats to make it feel like she was in a cat cafe. Because we couldn't get her there safely. And there were other situations too, where we organized either people coming in just because it wasn't safe for our patient to go out, but we do the best we can to make those moments.
And a large portion of your staff as well. I mean, it's not always possible, right? But when somebody is near end of life, typically your staff members know and you try to be there.
Absolutely. It is shared because we are so compassionate and we feel for every family, we feel for every individual. We care about our patients so deeply. And so when there is a passing, which happens often in our line of work, we feel that and we care and we just keep giving to those families.
Well, there's a lot of information to be had and conversations that I think a lot of people aren't talking about, right? Even for a second there, you hesitated with the word die, but then you brought up the fact that it's inevitable, right? It's going to happen to all of us at some point.
Yes.
Well, Kelly, thank you so much for your wealth of knowledge. Of course, this conversation is just getting started. We will talk about this much more on this Aging Untold Extra as we move throughout the year. And we'll be right back.
Your next chapter can be your most rewarding. Leading Later in Life is a program designed to help seniors grow, connect, and give back right here in Lucas County. You'll meet local leaders, build new friendships, explore meaningful volunteer opportunities, and enjoy exclusive tours of businesses and organizations, plus a guided look at the history that makes our community special. For more information, call or email the Area Office on Aging today. Scan the QR code to enroll now.
Just outside St. Louis, a group known as the Meemaw Brigade plays a critical role in the community.
Yeah, these safety-minded grandmothers and grandfathers help first responders train to do their jobs more effectively.
Reporter Tisha Powell shows us how this creative role-playing could help save lives.
Well, I just don't feel right.
My back of my neck is bothering me.
Confused and dizzy.
Okay. Don't worry, 81-year-old Sophia and 90-year-old Vito are going to be fine. Fact is, there's nothing wrong with them. They're members of the Meemaw Brigade, seniors helping St. Charles County Ambulance District first responders with their training.
Can you wrap the shoulder or anything like that?
Acting out medical emergencies. New Perspective in Weldon Spring is one of 3 senior living facilities hosting the EMTs.
Yeah, I think it's great.
Sophia Bax volunteered for the Meemaw Brigade. She's playing the part of someone with sepsis. It's a serious condition that can escalate quickly in seniors. Aging Untold expert Dr. Ray Rogers explains what that looks like and how it can start.
When you're in the elderly patient, that urinary tract infection can lead to sepsis real quick. And sepsis means that your whole immune system has been overwhelmed and it can no longer fight that infection. And so how that shows up, number one, in somebody who is senior is they'll be disoriented.
And Vito's role? A guy who fell in the shower. Dr. Ray says there are many concerns when this happens.
So after a senior has had a fall, are they conscious? Did they lose conscious? Did they hit their head? Do they have a head bleed? Are they just laying there and no one's there to see them? Who was around to see the fall, or maybe they're just there by themselves?
These paramedics will be ready when it finally matters, all thanks to the MEMA Brigade.
Well, that does it for this episode of Aging Untold Extra.
And we want to hear from you, so send us your questions, maybe your stories by email. That address is aginguntold@13abc.com. We want to cover the topics that affect you.
Yeah, and of course, remember, you can find all of our episodes available on demand wherever you stream 13 Action News. Thanks for watching.
Aging Untold Extra, sponsored by Area Office on Aging of Northwest Ohio.